Dr. Josh Luke here with the Health Wealth podcast and radio show. It's my honor today to have a former Obama administration staffer with us. It's Anton Gunn. Anton, welcome to the show.
Happy to be with you. Thanks for having me, Dr. Josh Luke.
And so tell us a little bit about where you're from, where you went to school, and how you ended up as part of President Obama's staff. That's awesome.
Yeah, so the long story short is that I'm a native of Hampton Roads, Virginia. I'm a military brat, come from 4 generations of military men in my family. And they all put on a uniform, but I didn't put on a military uniform. I put on a football uniform. And I see you're wearing the USC Trojans on your shirt there.
Here it comes.
I went to the real USC,
Okay.
the University of South Carolina.
So you played for the old ball coach?
I did not play for the old ball coach. About 20 years before he got to the school. But I played offensive line at the University of South Carolina, and I finished up in 1994. And when I finished up, my first career opportunity landed me working at a local nonprofit. And my boss handed me a clipboard and says, I need you to go out and help us to assess the health of this community. And I said, what do you mean assess the health? She says, well, you need to go talk to people about how they access the healthcare system.
Wow.
And so at 3 years old, I was going door to door in communities, going to neighborhood meetings and talking to residents. And I would ask them the following questions. Question number 1, do you have health insurance coverage? In 75% of the communities that I was in, the answer was no. And then my second question was, do your children have health insurance coverage? And 50% of the time, the answer was no. So then I said, well, if you don't have health coverage and your children don't have health coverage, what happens to you when you get sick? What do you do? And that began this journey of mine of collecting stories from real citizens in communities who struggled accessing healthcare in their communities. And I learned that hospitals, there are 2 types in every community. And what I mean 2 types, you might have 5 hospitals, but they all fall in 2 categories. And hospital number 1 is when something happens to you or someone that you care about, someone that you love. That's exactly where you want to be because you know you're going to get good care. They're going to take care of you and get you back home to your family. And then there's a second kind of hospital, the hospital that you don't want to go to because that's where you believe people go to die. And it didn't matter which community you were in. Some people loved the hospital and had great experiences and other people had bad experiences. And then that turned into a dialogue with those leaders in those hospitals about what they were doing to improve the broader health of the community, or as we talk about in the Obama administration, the triple aim theory. How do we focus on population health, the quality of care that people receive, and how do we lower the cost of health care by preventing disease and making sure people are healthy in community? Next thing I know, Josh, I was spending a decade-long career working on every aspect of healthcare, from Medicare Part D rollout to insurance regulations to how hospitals got to expand. So certificates of need, I was all in on prescription drug pricing, you name it, I had done it in the next decade. And that led me to a place where I felt like we didn't have enough leaders in public office who understood the complexity of the healthcare system. So I made a decision to run for public office. And I ran for the state legislature. And in 2008, I got elected to the House of Representatives, and I served on the Medical Affairs Committee, Children's Affairs and Social Services. And so I got a chance from a regulatory framework and from a policy framework to look at where the healthcare system was broken, how the waste was being generated, and how we were having inefficiencies, and how we deliver care and improve health outcomes. And after 2 years, 1 term in office, the Affordable Care Act passed on March 23rd, 2010, and I got a phone call from a former South Carolina colleague who was working in the Obama administration as a White House liaison, and he asked me, would I be interested in serving my country working for the President of the United States at the U.S. Department of Health and Human Services. And coming from a family who's had a long tradition of service, putting on a uniform, I never put on a uniform, but I felt like this is my obligation as a member of my community to serve. And so I got appointed to the regional office at HHS, the regional director's office based in Atlanta. If you know anything about HHS, it's the Health and Human Services Agency that manages all the health and medical needs for our nation. And Region 4 in Atlanta is the largest region It's 8 states, 62 million people, about $128 billion of the federal footprint in that region. And there were so many challenges in that
Plenty of
region.
challenges in that region for sure, yeah.
So I was there 19 months and was the most senior official from the appointed official in the Obama administration over health and human services. I worked with hospital CEOs and nurse managers and leaders, really helping them to understand how the Affordable Care Act can improve outcomes for patients, lower costs, and also improve the overall health of the community. That was my job.
Wow.
And then I got promoted. And I got promoted to Washington, D.C., into the Office of Secretary of Sebelius, where I became her Director of External Affairs. And I managed all of her relationships with every external entity. So whether it was big business or small business, hospitals, constituency groups, drug companies, healthcare companies, even the smallest women organizations in communities who cared about women's health, I was the conduit of how the Secretary's office interfaced with these groups. And after about 6 months, when it came time to roll out the Affordable Care Act, I moved into a role where I worked in the White House with the team who was developing a strategy on how we were going to get 7 million people enrolled in coverage and make sure that we lowered costs. And so I ended up in a senior role, kind of advising the president and the secretary on their strategy to roll out the Affordable Care Act so Main Street could understand it and take advantage of it. And that's how I got.
That's a cool story, man. I had no idea. There's a couple things you said in there that probably you didn't know about me that will obviously are some of the reasons that that you and I get along. But I was actually the CEO of several safety net hospitals.
Yes.
And it's interesting that Anton's probably the first person I've ever heard outside of myself say this, because people don't like to acknowledge it. There's the hospitals that you go to by choice, and then there's the hospitals that I ran. And believe it or not, in my almost 10 years as a hospital CEO over 3 safety net hospitals, I would say this exact quote in orientation to new employees. I would say, guys, this is a hospital that most people don't come to by choice.
Yes.
So let's be good. In fact, let's be great at what we are doing and not worry about what we're not. Let's serve the neediest of the needy. Let's make sure we're meeting their needs and not worry about the fact that America has a hospital crisis because there's the haves and the have-nots. That problem is not going to be solved in the near future, and our little safety net hospital is certainly not going to solve it. I have an interesting question I want to ask you about dish hospitals and private dish hospitals in a minute, but I don't want to jump to that yet. I want to talk about, by the way, when you were working in the eastern Atlanta region, was Dr. Richard Wild the medical director there? Because he's a great guy. I had a lot of conversations with him.
Yes. So Dr. Rick Wild was definitely the CMO at CMS there. He and I actually did a few events together where we literally traveled in Florida and a few other places.
Yeah.
Presentations to different audiences about the Affordable Care Act, about CMS's obligations and what they were doing to focus on innovation in the system and delivery system reform. And we talked a lot about the challenges inside of the healthcare system, inside of organizations. And so Rick is a fantastic guy, probably one of the funniest guys that I've ever had the chance to engage with. He has an incredible life story, not only as an MD, but also a lawyer. Most people don't even know that he's a lawyer.
Great presenter too, I'll tell you. And I remember I was actually the executive chair of the World Congress on Readmissions. I think in 2014. I think it was actually in Atlanta.
Yeah.
And Dr. Wild came, and I remember there was an awesome event that happened that day where, you know, those of you seen me speak, I'm provocative by choice. I talk about the elephant in the room, the things people don't want to talk about. And this is 2014, so about 2.5, 3 years after the ACA started really being implemented. And where I'm from in California, the implementation was slow. In fact, people wanted to not even acknowledge it was taking place on the hospital space because it was a threat to them. So my provocative platform was, why aren't we moving? Why aren't we doing this? We need to, transform to value-based care. But one of the things I talked about was,